My name's Noel. I work in the primary care clinic at Soldiers Memorial Hospital. I moved to Nova Scotia 2 years ago from Ontario, and I've been honored to work as an administrator for virtual care in Nova Scotia and Maple. I've personally been able to witness the great help it's been to seniors in our community. VCNS provides Nova Scotians on the 811 Need a Family Practice Registry free online consults with doctors or nurse practitioners until you can be placed into a permanent family practice. To access Virtual Care Nova Scotia, you must have a valid Nova Scotia health card, be on the 811 Need a Family Practice Registry, reside in Nova Scotia, have a valid email, and have access to a computer or a mobile device. If you don't have access to a mobile device or a computer, you can try connecting at a friend or family member's. Virtual Care Nova Scotia can provide health advice, prescriptions, diagnostic imaging, specialist referrals, and temporary in-person visits to your local primary care clinic. Virtual Care Nova Scotia is what some may call a wraparound service. It doesn't end virtually. If the doctor or nurse practitioner deems the patient needs to be seen in person, a referral will be sent to the patient's local primary care clinic for an assessment. By bringing the waiting room virtually to seniors, there's no need to travel. This is great for those with mobility issues and compromised immune systems. It also prevents having to drive in bad weather conditions. I'd like to provide some tips and tricks to seniors who may be trying to access virtual care and are experiencing some difficulties navigating the program. If the program states it's at capacity for the day, we are not closed. We recommend that you keep on trying at different time intervals throughout the day to connect, right up until close. We pause the platform temporarily to prevent overflow, but as people move off the program, it makes room for more people to connect. It's recommended that you return 3 to 4 weeks before running out of your medications to prevent going without. When using Virtual Care Nova Scotia, patients are responsible to book their own ECGs, X-rays, and blood work. You can find our booking link on our Nova Scotia Health website. It's the patient's responsibility to connect to Virtual Care Nova Scotia to review any diagnostic imaging or lab results that have returned. You can speak with any doctor or nurse practitioner and they'll be happy to review them with you, and any next steps if needed. You can find our registration link to make your free account on our Nova Scotia Health website. Maple is a company that provides online health care. They have partnered with Nova Scotia Health, who has paid Maple to provide free virtual care to all Nova Scotians. If you already have a pre-existing Maple account and you would like to switch over to a free Virtual Care Nova Scotia account, you can find our conversion link to switch over on our Nova Scotia Health website. We recommend that you check your account frequently when trying to connect to a doctor or nurse practitioner to prevent losing your spot in the queue. We recommend that each individual have their own account for privacy issues and for easier self-management and organization of your profile. This will make each individual account easier to access and organize. An added benefit that Maple provides is you can actually download all of your consults and any results that have returned to the program so that you can easier access all of your health records and bring them with you if you need to go to the Emerge or go to a walk-in clinic. You'll always have records. You can locate our hours on our Nova Scotia Health website, but keep in mind they are subject to change. When asked to speak about personal first-hand experiences, one particular story comes to mind. I was at a community healthcare conversation when a man approached me looking for information on virtual care. This man had many health concerns. I was able to provide him some handouts and contacts to virtual care. Luckily, the man was connected to myself and I was able to help him set up his account and navigate the program. This lovely gentleman later came through to the primary care clinic. He was assessed in person, and I found out later that he had 2 surgeries, and I have spoke with him and he is doing great since. The gentleman states that he is in better care than before he connected with Virtual Care Nova Scotia. If you're ever needing help on learning how to navigate the program, or just have a question, please reach out to Virtual Care at virtualcareNS@nshealth.ca. Virtual Care Nova Scotia isn't a one-size-fits-all solution, but it is bridging the gap for Nova Scotians while they are waiting to be placed into a permanent family practice. You will know you've signed up with the correct free version of Virtual Care Nova Scotia when you see our Nova Scotia Health logo in the top right-hand corner of your app or on your desktop computer. Thank you for watching today. It's been a pleasure being able to provide you with all this information on Virtual Care in Nova Scotia. If you're looking for further information on Virtual Care NS, please reach out at our contact 1-888-755-8555. It can take up to 2 weeks for a return call, but someone will be in touch. You can also reach us at our email, virtualcareNS@nshealth.ca.